It is another interesting edition of your program of choice, Health Affair on AIT, a platform where we focus on public health challenges, issues about women and children with a view to finding lasting solutions. Our focus this week is on sickle cell anemia. We'll be right back after our new segment. Don't go away, please stay tuned.
President of the World Medical Association, Osahan Enabulili, has stressed the need for global health security through the building of more resilient health systems and workforce to address current and future challenges in the sector. Speaking at the scientific session of the 74th General Assembly of the World Medical Association in Kigali, Enabulili noted that global health security has become necessary following reemergence of infectious diseases and the health impact of climate change and rising trends in antimicrobial resistance. Enabulili also called for proactive measures on the part of political leaders and governments across the world to quickly find solutions to the projections, which tend to suggest a workforce deficit of about 10 million by the year 2030 in the health sector. Enabulili commended current efforts at developing a post-COVID-19 pandemic treaty and recent declaration on pandemic prevention, preparedness, and response. The Edo State-born medical expert just concluded a one-year tenure as the president of the World Medical Association. To improve the chances of survival for children with cancer in Nigeria, some health experts are now calling for more awareness and creation of register to help for proper monitoring of affected persons. Speaking with AIT in Lagos, the respondents noted that out of about 40,000 persons currently diagnosed with cancer annually, over 80% lacked access to clinical care.
We've had the release of balloons, we've had the lecture, there's an ongoing art exhibition done by children who have cancer and children who want to encourage, these kids who have cancer. This work is the last of our activities for this year. In Nigeria, the statistics is not as good as it should be. One of the things that Children Living with Cancer Foundation is doing is trying to create a childhood cancer register here in Nigeria. And we are looking for funds to start that so that we are able to know the particular amount of children or number of children who have cancer and what we can do for them. So we need to have that cancer register here in Nigeria.
What is more worrisome now is the high cost of care, which is between 3 to 5 million for early diagnosed cases.
The treatment is not easy on anybody, child or adult. Then of course the finances, the funds, is not a one-off thing. It's a long process. And even after that child is pronounced fit, the child still needs to be maintained almost for life. So there are many, many challenges. And of course, the lack of government input in child cancer treatment and awareness is most of the things that we go through here in Nigeria.
While calling for more awareness to help in preventing the disease, the experts call for more training of professionals in the field of oncology to bridge the doctor-to-patient ratio gap existing in Nigeria.
They should feed their children with organic food that are naturally grown, food that are not processed, that are not canned food, that contains nutrients like minerals, vitamins, amino acids, basically fruits, vegetables, grains that helps the system.
Seek medical advice for anything that you don't understand. Any lumps anywhere, any bleeding that shouldn't happen. A child is brushing and a child is bleeding. In this day where there's so much sunshine and vitamin C, that shouldn't happen. Easy breakage of bones, fractures is another thing that one should look at and take into. Then headaches, early morning vomiting, a child not being as bright as the child should be, or even being as happy, depression and all those things are things that one should look out
for. Women as mothers of the nation have continued to demonstrate the willingness to support a better Nigeria, especially when it comes to the issue of prayers. This clearly demonstrated by the large number of women among the 350 pilgrims who traveled to Jerusalem from Lagos a week ago. During a church service at Chapel of Christ the Light to commit their journey into God's care, the Executive Secretary of the National Christian Pilgrims Commission, Reverend Yakubu Palm, urged them to be good ambassadors to Nigeria.
I believe that they are going to be happy with what they are going to see over there. And to me, most of them were almost losing hope that they are not going. But now it is a renewed hope for them to go and see the promised land. They will see a lot of the places that Jesus went there himself, performed miracles, signs and wonders. And beyond that, I want to encourage them to go there and pray for Mr. President, and also pray for the governor of Lagos, and pray for our country, that God will help us to overcome all the crises that we are witnessing day by day. The bandits are there, the kidnappers are there, the Boko Haram is there, and all the rest. Lagos is one of the highest states that is giving us pilgrims traveling for the Holy Land and for the pilgrimage exercise. So we really, really appreciate them. We have always been talking against abscondment. Nobody should run away. It gives us bad name.
You are representing the body of Christ, and you are representing your family as well. Our father-in-law, sir, Reverend Yakubu Palm, I want to assure you that no one here will run away.
It's an experience, so to say, that one that at a point in time dreamt to experience in the way that, okay, what you read in the Bible about the birth of Jesus, the baptism of Jesus, how Jesus was crucified, how he resurrected, the tomb of Jesus, and every encounter we read in the Bible. So it's more like a drawing now to experience it. So the Bible at the end of the day is not going to be fiction, that it actually happened, and I'm going to be a partaker of that encounter. I am so passionate that one of my prayers, I'm praying for Nigeria, that God will return Nigeria back to the days of its glory. I remember my grandfather used to tell me about Nigeria, where you buy when you take a pound to the market and you have a whole house and all that. So I'm trusting God for a total restoration, a total transformation for Nigeria.
Over 6,000 pilgrims have so far traveled from Nigeria to Jerusalem for the Holy Pilgrimage in 2023.
Welcome back. From an estimated 50 million persons said to be living with sickle cell anemia disorder globally, Nigeria accounts for about 4 to 6 million based on available statistics, according to some experts at an event recently in Lagos. The experts who called on government to integrate sickle cell care into the National Health Insurance Scheme also called for building of more sickle cell bone marrow transplant centers in Nigeria. Sickle cell disease is a group of inherited blood disorder that makes the red blood cells become sickled in shape. The disorder occurs when a child inherits the X gene from the parents.
First sign you see in a child with sickle cell is around, you will not at birth, but around the age of 5 months, 6 months, 7 months, thereabouts. You have what we call hand-foot syndrome, swelling of the top of the hand and swelling of the top of the foot, and it's painful swellings. That's the first sign you see in a child with sickle cell. And the reason you don't get it when they're born, because in a newborn baby with sickle cell, you cannot tell the difference just looking at the child between that child and a child who doesn't have sickle cell. There's no difference. The first sign is that swelling of the top of the hand and the top of the foot. They sometimes experience what we call stunting. They don't grow as at the same rate as their mates, and usually it's a concern for parents. They will tell you also in clinic, my child is not growing like their mates, and then you may not know that child has sickle cell, but usually that's a pointer to say, okay, let's check the child's genotype, whether it's the child is SS or not. But usually it's pain. When they come in with pain, what we call bone pain crisis. You probably heard about that too, and that's something that comes because sickle cell is a problem that lies that's in the red blood cell, and in the red blood cell is a substance called hemoglobin. Okay, hemoglobin is a substance that helps us to carry oxygen around our body. for people with sickle cell, we designate the hemoglobin as S. The usual hemoglobin for most people is A. We don't like to call it normal because that means that the sickle cell people are abnormal. So we say the usual hemoglobin is A. Okay. Now, in fact, I'll dial back. The reason in the newborn you don't see any symptoms or sign is that they still have what they call fetal hemoglobin. That's the kind of hemoglobin that you have when you're in your mother's womb. Fetal from fetus. And it's very efficient, like A. Okay, but it tides the baby through the first few months of life. But as the baby is growing older, that hemoglobin F will be going down. Then the genetic makeup of the child, if it's S, begins to come up. And S is not as effective or efficient. The red blood cells with hemoglobin S are shaped like a sickle. And with that shape, it's not able to flow freely through the smaller blood vessels. So they begin to get stuck and then block the blood vessels. And when the blood vessels are blocked, blood will not flow to the tissues or to the organs. And then the body's way of telling you there's a problem is pain. Pain is actually a protective feedback mechanism that tells the body that there's a problem. So other complications include priapism.
As a mother of a child living with sickle cell, the disorder, according to Uwa Ohiko, who battled the condition for 27 years, could be better imagined than experienced. Her son eventually had a bone marrow transplant.
Why is the stigma against that child or that person that is having the disorder? The stigma should not be there at all. People, we need to be more tolerable, even in terms of health care. Oh my goodness, health care is another beef that I have with health care providers. Health insurance, medical insurance, for example. You take out medical insurance and they say genetic disorders are not covered. I think that is one area that an intervention in terms of policy making has to happen. Go to India, they have bone marrow transplants, and that's all these hospitals do. How is it that Nigeria has the highest rate of sickle cell disorder and we just don't care? That's what I feel. Either we set up centers where these things are done, or the big hospitals, and there are many big hospitals that can have this thing as well.
Not many people are that fortunate to afford a transplant. Andrew Tohina, for instance, lost 2 of his grown-up children within a space of 6 months to sickle cell disease.
Anthony was the name of my first son. He read biochemist at the Ambrose University. He had graduated. Then the sister, who read law too, was about to resume in law school a week. That her own, it was more of the negligence of a doctor. We later knew also that that person was not a qualified doctor. So these are part of the fallout of sickle cell crisis. I traveled with the mother who were not at home. He had crisis and they rushed her to the nearest hospital. The hospital we use is Federal Medical Center, but because of the distance, then they rushed her to a nearby hospital, and they wrongly transfused her with blood, which caused her death.
Ayola Olajide is one of the panelists at the summit. He has survived the condition for close to 60 years running.
I've been living with sickle cell for the past 59 years. The doctor once told me I would not live to the age of 25, but I have lived twice that, and I'll be 60 in a few weeks. There is no management except the grace of God. Of course, you do your best, you do what you can, take your routine medications faithfully and religiously, and lots of water. Water has been my #1 medication for sickle cell, medication in quotes. So it has helped me to clear my eyes. I used to have yellowish eye coloration. I used to have pale skin, but water has done a lot for me. Water is the #1 drug for sickle cell. I also take my medications right on time, and I'm always very close to the hospital. Parents who have children with sickle cell should not lose hope. They should not take to the negative perceptions of the illness, but they should just focus their attention on the children, take care of them as much as they can.
The first thing we say is, if your child has a fever, please don't stay home.
Just don't give paracetamol and stay at home and just think it's malaria. Bring your child immediately to hospital, because it could be a very serious illness like a complication called acute chest syndrome, which can be rapidly fatal. So you don't joke with that at all. First thing is make sure that you treat your child, and then give them their routine medications daily. The folic acid they must take daily. It helps them to replace the blood cells that break down rapidly. Those cells that are not well misshapen, those red blood cells tend to die off very quickly, whereas the normal cell will live for 120 days. It's a red cell that has sickle cell, that's sickled, will live just for 10 to 20 days. And that means they're usually short of blood. So anemia is very common for sickle cell. Sometimes when it's so bad, you see jaundice. The eye will be yellow. The white of the eye will be yellow because they've broken down the red cells so rapidly and the liver cannot cope. So, and then there are do's and don'ts I've mentioned earlier. Drink plenty of water, avoid excessive exercise, physical exercise, and even emotional stress can lead to crisis. We want to prevent crisis as much as possible. There are doctors who prescribe for patients who have sickle cell children who have a high risk of developing stroke. They place them on what we call chronic transfusion. That is blood transfusion every 3 weeks. Every 3 weeks, and that's a lot. So many times they're not able to comply. Why? Because there's not enough blood. There's not enough. So we still have that challenge of getting adequate blood. Blood saves lives across board. For accidents, injuries, hemorrhage in pregnancy, that's in fact one of the greatest causes of deaths, maternal mortality, bleeding, hemorrhage in pregnancy during delivery. But sickle cell is my focus. I want to be sure that we get enough blood for our patients with sickle cell. We also do what we call exchange blood transfusion, and it helps them during crisis. It helps them when they have stroke. It helps when they have what we call acute chest syndrome. These are various complications of sickle cell. In the area of funding, I still say we're advocating that they do more. In the area of awareness, I think that awareness, when it comes to the sickle cell NGOs, we do that more, and I believe we're better positioned to do so.
A lot needs to be done. We need to change perception. And sometimes the question you ask is, how many people really do know anything about sickle cell and the condition, and people living with sickle cell? So it means that we need to do a whole lot more awareness. How to prevent stigmatization, how to prevent bullying, especially when you notice all the little signs that some people who live with sickle cell carry. What I've suggested, that you work a lot with influencers, with motivational people. We also extended that from the Lagos State House of Assembly, the leadership of Mudashiru Ajayi Obasa. We are willing as well to not only understand but also do policies that will encourage people or create more awareness towards the condition called sickle cell. We only know AAAS, but we don't know other things. The nitty-gritty that we also need to look at stories, success stories, and even stories that are not even successful. People that have tried hard. They are human beings, and we need to also hear them out.
In our marriage classes, it's a sine qua non. That means that topic has to be discussed before any marriage is, signed, that the people can marry. It's not that the church would force them not to, but you would have gone a long way to educate them that the decision they are going to take is informed awareness. So that's why the family and human life is very important to us. So whether a sick child or a healthy child will be equally important, of interest to the church. So for us, the healthier population, the healthier the families, the healthier the children or marriages are, the better for all of us. You have a child that is not growing, the development is not doing okay. You see a child who is constantly sick, constantly anemic, constantly maybe having yellow eyes. You have to start investigating. I say, what is this? Or even you see a woman who tells you, I have delivered 4 children, 3 died. Or I had 3 miscarriages and 2 alive, 1 is sick. Then you start questioning, what is your genotype? Because some don't know. And some know, just the denial aspect of it. You have seen a young man you want to marry, or you've seen a young lady you want to marry. You decide your genotype is not what you know. And that is it. So we try to tell people, face reality, and that will be of help.
As part of efforts to help change the perception, the media has been taxed on accurate information about the disorder for enlightenment purposes. While touching on the theme, sickle cell disorder, changing the perception, the experts also called on intending couples to know their genotype.
So today, because of the awareness created, we insist on intending couples to make sure they know their genotype. Like some of us who married blindly those days. These days, it has become a norm that even if the church that will conduct your wedding will ask for your genotype certificate. So the perceptions are changing. We now know that it is real, it's a blood disorder, and we can now confirm your genotype before you marry.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
If you are just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment, an aspect of the show that focuses on eating right to stay healthy.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week.
Locust bean, commonly called Iru in Yoruba, Ogiri in Igbo, and Daddawa in Hausa, is a local seasoning used in preparing soups and stews. It can also be referred to as the African locust bean, with the botanical name Parkia bigiobosca. The locust bean can be found in a wide range of environments in Africa and is grown for its pod that contains both sweet pulp and valuable seeds. Research shows that locust bean helps to promote good eyesight and aids in treatment of health conditions like hypertension, stroke, diabetes, anemia, and malnutrition. Consuming a good amount can equally reduce fever and boost the immune system. The most valuable part of the locust bean is high in protein, carbohydrate, fat, calcium, and other vital nutrients cherished by the body. Consuming locust beans is good for your health.
On our clinical segment, we give you tips for healthy living.
Are we noticing that in a bid to cope with the trauma that you've experienced, they're turning to, harmful coping strategies such as drinking alcohol excessively, use of marijuana, other illicit substances of abuse, or are they self-harming? And so some people, when they're under a lot of pressure and stress and maybe trauma, they start to cut themselves or may even go to the extremes where they think of taking their own lives and may eventually do so. So, these are the different presentations of trauma. But like I said, there's no one size fits all. And it's important to, for people to realize that if you are traumatized, you are not alone. Trauma happens to all of us at different times of our lives. But the most important thing is getting the help you deserve as soon as possible.
Join us on our Perception segment for a way forward on how to improve human lives and the nation's critical infrastructure.
It's simply for the populace to work hard, hardworking. We have to support the government. And we just have to be honest and transparent in whatever we do. And again, we should be less self-centered. Let's think of the larger society. When we do that, the society will be better than what we have now. Remember, you are not going to eat more than what your belly can take.
That's how we wrap it up this week. Thanks for spending your time with us. Let's do it again same time next week. And please endeavor to advertise your health products and services on the program. I remain yours truly, Ushuomo Daniels. Please keep staying safe.